Hi, welcome to our discussion on preventing substance abuse in our young adults. As you can see, we have a room full of people. We have our teens with us, we have school counselors, we have teachers, and we have mom and dad. So thanks for joining us today. The first thing we want to kick it off is, how can everybody in this room have education that we can screen some of our young adults? As you know, you often hear it takes a village to raise our children, and this is our village. So thanks for joining us. So children that are age 7 to 9 that start showing troubled behaviors tend to start experimenting with substances by the age of 14. So some of these troubled behaviors that we can identify early are things such as academic failure. Are they struggling to hit their landmarks, reading, writing, their math skills? Do they have early difficulties in peer relationships? Are they often angry? Can they play in a group of kids? Do they isolate themselves? Socializing with other troubled peers. So if you have a child that tends to exhibit troubled behavior, are they starting to gravitate to one another? And aggression and impulsivity in the classroom. Are they able to sit and listen to a lesson? Do they get up and walk away when they're told not to? Do they yell out during the middle of the class? Those are some things that teachers, you should be screening for. And make sure that you let the parents know the behaviors that you're seeing and let the school counselors know as well. Early intervention is key. Next, how can the people in the community screen? So the people in the community can screen for a multitude of ways. One of them is just identifying the kiddos that have a lack of structure and discipline. Are they often out late running around in the dark? Are they riding the bike unattended without a helmet? Do you see that there just doesn't seem to be the parental attention that there should be? Is there lack of nurturing in the home environment? Do you see that parents don't necessarily want bothered, don't have time for their children? Are the parents using substances? And do the parents have severe mental health disorders that prevents them from even at times taking care of themselves? Those are some of the things that we can screen as a community. Talk to the teachers, talk to counselors to get these people the attention they need. And also, as mandated reporters, to call Childline. If a child is not being cared for properly and there's drug abuse in the family, make sure that you know that you have the option and are mandated to call Childline. The next thing is, how will the pediatrician's office screen your kiddos? So what we have two screens that's been backed by science that have been a wealth of insight with our kiddos in substance abuse. The first one is S2B1 and the second one is BSTAD. These both can be administered either on a computer somewhere in private or on a tablet that they can give their children. And there's just a few questions based off alcohol, cigarettes, and marijuana. And it will ask your child, have you ever? And if they answer yes, it'll then go to how often. Then the science behind this is it computes the provider a plan and what the next steps should be and what we should do for our young adults to get them the help that they need. And then the last thing on screening that I want to talk to all of you about is, why should we screen? Well, we need to screen because we need to normalize conversations with our teens and young adults. You don't want your teenagers learning about the dangers of drugs from other children that are maybe promoting those drugs. You want your children from a younger age to be very familiar with the dangers of alcohol and drugs and normalize asking conversations and questions. Screening identifies the people that we need to focus on and helps us get to our next steps. It can also lead to early referrals and interventions, and just overall promotes healthy choices and behaviors. So the next thing I want to talk to is about the students in the room. So students, how do you recognize substance abuse among your friends? Some of the big red flags are losing interest in activities that they once enjoyed, sleeping a lot, noticing that eyes are bloodshot and watery all the time. They start missing school. They just start generally breaking the rules. They become suddenly much more independent. They're angry, they're aggressive, and they just leave their normal friend group and suddenly go into a total new friend group. Don't be afraid to speak up. As I said before, early indication is going to be the best way to prevent further addiction. Why do teens experiment with drugs? Why do you guys get to the point where you consider that? Teenage years are tough, so we're trying to fit in. You're trying to feel good, thrill seeking. You're self-medicating. Maybe you're having feelings of anxiety, depression, and you don't know how to communicate those out. Maybe it's experimentation. Last part of our brain that develops is decision making. And lack of education. Maybe our kiddos just haven't been fully told the risks that alcohol and drug poses for them. So guys, who can you talk to when you identify a friend or you find yourself thinking about starting to experiment with drugs? Talk to any adult you possibly can. Talk to your teachers, talk to your school counselors, talk to your parents, talk to your religious resources. We have to be talking to adults and bringing this to attention and normalizing this. Thank you all for your attention. I appreciate it.